Hi everyone, my name is Rodora Zepeda and I'm a physical therapist. I will be discussing breathing techniques and strategies, part 1. This is a two-part series and this serves as a guide in facilitating effective breathing and movement strategies to promote wellness. This is a video companion of the booklet. Why is breathing important? Breathing or ventilation is the process of moving air into and out of the lungs to facilitate a gas exchange with the internal environment, mostly by bringing in oxygen and flushing out carbon dioxide. Inhalation is the drawing of air or other substances into the lungs. Exhalation is the act of breathing out air. Functioning depends on the ability to breathe. If you cannot breathe, you cannot function. Our bodies cannot store oxygen, so we need to breathe day and night to move air into and out of the lungs. The rate and depth of breathing can be consciously modified, but the underlying need to breathe is controlled by involuntary centers in the brain stem. Responses to changes in oxygen and carbon dioxide levels control our breathing, even without our attention. The key difference between breathing and respiration is that breathing is a physiological process that takes air in and out from the respiratory system, while respiration is a biochemical process that utilizes oxygen and produces energy through the breakdown of glucose. There are two types of respiration, the external respiration and the internal respiration. External respiration is the exchange of oxygen and carbon dioxide within the lungs. Internal respiration occurs in body tissues when oxygen, which is carried in blood from the lungs to order to fuel cellular processes, is exchanged for carbon dioxide. Water and carbon dioxide are produced when cells break down nutrients such as glucose. Carbon dioxide travels from blood to the lungs and is exhaled. The airway function allows airflow in ventilation from the external environment to the respiratory surfaces where gas exchange for respiratory processes can occur. The airway structure is divided into upper airway and lower airway. Upper airway is composed of the nose, pharynx or throat, and larynx or voice box. The lower airway is composed of the trachea or windpipe, bronchi, and lungs. The movement of air into and out of the lungs is generated by differences in pressure inside and outside the body. The diaphragm is the primary muscle involved and is assisted by the internal and external muscles located between the ribs and in the abdomen. The accessory muscles involved in respiration are the neck and chest muscles. In inspiration, the diaphragm contracts or moves down. Then the rib cage expands and lung volume increases. In expiration, the diaphragm relaxes or moves up. Then the rib cage retracts and lung volume decreases. These activities compress the lungs, thereby contributing to airflow out of the lungs. The accessory muscles are recruited during times of exercising because of the increased metabolic need and also during dysfunction in the respiratory system. Here are ways to help your lungs get more air. Pursed lip breathing is a breathing control technique that will help you control your breathing and shortness of breath. It will also help you feel more in control and make it easier for you to do things. To start, breathe in slowly through your nose to the count of 1, 2. Then pucker your lips as if you're going to blow out a candle. Exhale slowly and gently through your lips for 4 or more counts. Breathing out should take twice as long as breathing in. Do not force your lungs to become empty. The second breathing control technique is the diaphragmatic control breathing, which is a deep breathing exercise that strengthens your diaphragm, supplies more oxygen, relieves stress, and improves your concentration. To start, you have to sit comfortably and relax your shoulders. Then put one hand on your diaphragm, which is in the midsection just below your breastbone, and the other hand on your chest. Now inhale slowly through your nose. Push your diaphragm out while you breathe in, making sure your chest is relaxed and not rising. Then push in your diaphragm and breathe out using pursed lip breathing technique. You should feel your diaphragm go down. Coordinate breathing with activities using ventilatory movement strategies to conserve energy and improve function. Inspiration is associated with movements of trunk extension, arm reaching forward or overhead, arm reaching sideward, and shoulder rotation away from the body. Expiration is associated with movements of trunk bending forward, arm reaching behind, arm moving towards body, and shoulder rotation towards center of body. Here are two examples of ventilatory movement strategies that you can incorporate in your daily activities. While putting on pants or socks in a long sitting position, first take a deep breath while bending trunk slightly backwards, then blow out or huff out while bending trunk forward to reach toes. This combines the functional daily tasks of dressing with improving breath control, trunk control, and airway clearance techniques. Coming up to standing, should initiate the forward trunk leans with exhalation and initiate the standing phase with inhalation and neck extension. Returning to sitting should be accompanied with slow controlled exhalation, such as in pursed lips, blowing, or counting out loud. Here are breathing tips to guide you. Practice breathing techniques several times every day. Expand belly while inhaling, retract while exhaling. Inspiration is an active process that requires energy. Expiration is a passive process that does not require energy. Keep inspiration and expiration regular, preferably exhaling a little longer. Look into mirror to watch your breathing. Do not take too many breaths, as you can get lightheaded because of hyperventilation and blowing off too much carbon dioxide. These are the common respiratory care modalities and equipment at home. Oxygen is a drug and used to treat and to prevent hypoxemia, excessive work of breathing, and overworked heart. Pulse oximeter measures heart rate and blood oxygen saturation. The normal value for oxygen saturation is between 95% to 100%. Below 90% requires supplemental oxygen. The normal value for heart rate is between 60 to 100 beats per minute. The incentive spirometry is a visual and audio feedback device that encourages slow, deep inspiration. This treatment should be performed frequently, up to every hour, to treat or prevent lung collapse, especially in post-operative thoracic and abdominal patients. Aerosol therapy is to hydrate dried retained secretions, to improve cough efficiency, to restore and maintain function of the mucociliary elevator, to deliver medications, and to humidify gases delivered through artificial airways. The CPAP machine uses mild pressure to keep airways open and are typically used by patients who have breathing problems during sleep. Thank you for watching and listening, and I invite you to watch part 2 of this presentation, and it will focus on therapeutic interventions to optimize ventilation patterns.